Hello, this is Sudharshan, and in this episode, PA 24.2 and 24.3 will talk about peptic ulcer disease. So, peptic ulcer disease. So, this is a condition where there is damage to the stomach lining, the erosion of the lining epithelium of the stomach because of excess acid secretion. So, yes, and now coming to the risk factors, the number one cause being Helicobacter pylori infection. And apart from that, there are psychological factors, any addictions where, like alcohol, drugs, smoking, drugs very commonly NSAIDs, any underlying gastric conditions like Zollinger-Ellison syndrome, or a non-gastric condition like COPD, chronic obstructive pulmonary disease. Right. So there are basically two kinds of peptic ulcers. One is duodenal and gastric. So duodenal one occurs in the duodenum, where first part of the duodenum. Gastric ulcer, gastric, so it occurs in the stomach. Duodenal ulcer is more common. Alright. And very commonly pathogenesis, it would be, as I said, the erosion of the lining epithelium of stomach. If it is gastric, if it is duodenal, it will be the duodenum. Right. And then we have the clinical features. So mainly with respect to the gastric ulcer, we will see. So mainly we can see hematemesis, hematemesis, weight loss. Then apart from that, epigastric pain, and that pain can be radiating to the areas like chest, back, the abdominal quadrants. GI distress can occur. And then hematemesis, that is nothing but the blood in the vomit. And even sometimes melena can occur. That is hematochezia, that is black stools can sometimes occur. And complications such as fistula formation can also be seen. Right. And the opposite will be there for the duodenal ulcer. But a very important point to remember is that pain is relieved while taking food in duodenal ulcer, but it is aggravated in case of gastric ulcer. And both of these are very common, especially in the rainy season. But seasonal variation is common for duodenal ulcer. Right. So when it comes to the diagnosis, imaging techniques can be done like CT, abdominal radiography, etc. And treatment would be surgery and medications, like very commonly proton pump inhibitors and antibiotics, because Helicobacter pylori is the main cause. That is why. And then let us see the gross and microscopic features also. So grossly, we can see two kinds of the gastric ulcer, benign and malignant. The main thing is in benign, it looks like a small punched out hole. Whereas in malignant, there is a big hole, a bigger hole of a bigger size, and rolled out margins will be seen. And microscopically, there are four very important layers to know. One, necrotic zone. Second, superficial exudative zone. Third is granulation tissue zone. And fourth is zone of cicatrization. Necrotic zone, that is where the dead and damaged cells are present. Mainly we can see fibrinous exudate, that is the collagen fibers with the fluid. And obviously there will be some inflammatory cells, inflammatory infiltrate, WBCs, all those. Then superficial exudative zone. So just below the first zone, that is the necrotic zone, we have superficial exudative zone. And the most important is, apart from the fluid, the inflammatory infiltrate, most importantly, coagulative necrosis is present. Coagulative necrosis. and then that's why we have the smudgy appearance will be there. And granulation tissue zone, obviously from the name, granulation tissue, that is the collagen fibers, then the inflammatory infiltrate, the multiplying blood vessels, all those is present. And zone of cicatrization, where we can see the collagen fibers which are present. Right, so that is all with the peptic ulcer disease. So thank you so much. We'll see you in the next lesson.